This week, Fox News decided to launch a new theory as to what's really going on. And that theory is that hospitals, the World Health Organization, even the government itself are overestimating the number of deaths from coronavirus.
Other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death. If someone dies with COVID-19, we are counting that as a COVID-19 death.
Can you be sure? I mean, you hear from coroners that that's not necessarily the case. Are you sure? How can you be confident about that? And is there any concern that it skews the data that you're trying to collect in terms of projections and things like that?
Well, I think that would apply more to rural areas that may not have the same level of testing, but I am pretty confident in New York City and New Jersey and places that have these large outbreaks and COVID-only hospitals. I can tell you they are testing.
But they're all on the same page right now. And that page is the numbers we're seeing are not accurate. All saying the same thing. We're not actually getting the accurate number of deaths. And the reason they say that is because they're claiming that anyone who has been diagnosed as positive with COVID-19, if they die at all, that gets counted as a coronavirus death. So even if you have COVID-19, they say, and then you die in a car accident, they're saying that that is getting reported as a COVID-19 death. Now, there's a little bit of truth to that.
As a physician, I received an email last week from the Department of Health coaching me on how to fill out death certificates. And I've never really received coaching from the Vital Statistics Agency in terms of how to do a death certificate. But basically, I felt like they were saying, you don't have to have a confirmed laboratory test for COVID-19 in order to make the death certificate be COVID-19. So
wait. Sir, I don't mean to interrupt you, but that and what you just said, I think is critically important. Can you repeat what you just said, please?
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19. Now, we've not done that. If someone has the pneumonia after and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but my heart is sinking right now as you're telling me this. You're a doctor. Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate this person's death was caused by COVID-19? That does not sound right to me.
I went to the person in our office who does most of the death certificates over the last 10, 20 years, and I said, does this sound right? I had her look at the documents that I'd printed off, and she said, well, we've always been told that you always put down just facts. You don't put down any probabilities. You don't put any presumptions down. It's just what you know. And so this is concerning. And it actually gets to your point, Chris. When we start talking about the data that goes into the modeling, we have to ask ourselves a question. Are we being forthright? Are we sharing with the public? Minnesota, North Dakota, we don't need to be having it sugar-coated. We want to know what's going into your modeling.
So with that being said, why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people. And I worry about that. I worry that sometimes we're so darn interested in just jazzing up the fear factor that, sometimes people's ability to think for themselves is paralyzed if they're frightened enough.
Because the facts are, hospitals around the country, medical professionals around the country are actually telling us the death toll from this is far greater than what we're actually hearing about.
And that's not where I want people to be. I want people to say, we're going to get through this. I'm going to use my head. I'm going to go to different sources. I'm going to listen to different sources. And I'm going to think for myself, because that's what America's about.
But not according to Fox News. Nope. According to them, if you do not specifically die from this disease, we can't count that. And therefore, thousands upon thousands of people have apparently been misdiagnosed, which also is absolutely not the case. I mean, you could probably count on just a couple of hands how many people have been counted as dying from coronavirus, but really something else killed them and whatever. It doesn't matter. It doesn't matter.